We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. Today I have with me Brian Terry, and we are talking about all things water. Why water changes movement, pain, recovery. Why would you get in the pool to manage any of your symptoms? And this podcast is really unique because it's a unique way of treating the body and the pain system. And buoyancy and water really make a huge difference. And Brian is an absolute expert in this. Most rehab typically happens on land, and we do a lot online. And sometimes we have to offload the body and take gravity out of the equation. But gravity isn't neutral. For many patients, it's the barrier to movement and healing. And this is just another resource that we have that can help in pain and managing pain. So we're super excited to talk about it and improving people's function. So we're talking about changing the environment to change the pain, movement, and outcomes for patients. So our guest today, Brian Terry, he's a doctor of physical therapy. He's the founder and clinic director of Sandy Aquatic's Physical Therapy and Wellness. He's been a University of Utah, or he was a University of Utah graduate, just like myself. Love the U. Clinical certification in aquatic physical therapy, so unique specialty. He's an instructor at multiple doctor of physical therapy programs here in Utah. He is a certified nutritional physical therapist. He served on the board of directors of American Physical Therapy Association Academy of Aquatic Therapy. And he's been an instructor of aquatic physical therapy curriculum at the University of Utah and Rocky Mountain University. So has a ton of experience in this area, an absolute expert. So I'm excited to dive into this. So my promise to you today is if pain, fear, or movement limitation have stalled your progress, this episode explains why water can help you and how to do that efficiently. So welcome, Brian, to the podcast.
Thank you. Thank you. I'm so glad to be here. Thanks for the invitation.
You're welcome. It's a pleasure to be able to talk about this conversation because not a lot of patients understand that it's a resource to them.
Right. And honestly, there's not a lot of resources for aquatics out there.
Yeah.
It's hard to find. And
it used to be a lot bigger and in the physical therapy world, and now it's gotten a lot smaller.
that's a good point. And when I'm teaching the students at the universities, we talk about the history. Water's been around for a very, very long time. And it's fascinating because you're talking about ancient Rome, the Egyptians, the ancient Asian continent, and they all used water as a medium to treat disease in some way or another. And now we've got way more resources available, but we don't really get to use them in this kind of way, or we don't know about it.
Yeah, absolutely. Tell us what initially sparked the interest to do aquatic therapy.
It's a funny story. I'll make it short. But when I graduated the U, I just threw my resume out there. I was trying to find a job, and I wanted an outpatient setting. I liked sports, orthopedics, kind of anything, really. Just land myself somewhere. I had an undergrad degree in business and entrepreneurship, so I just happened to throw my resume out to this clinic that's in Sandy that was struggling. It had been turned over a couple times to different groups, and the new group was looking for somebody to start up a program. And they hired me. So I kind of came into the world of physical therapy with no real resources, at least in terms of therapists, and it had a pool. And I just thought, okay, I love pools. I was fascinated by aquatics in the curriculum up at the U, but I hadn't had an opportunity to really get in deep. And I just kind of decided this is going to be my thing. I'm going to take it from here.
Awesome. And now you spend how much time in the pool?
Many hours. Many hours a week. So the majority of our patients come in for the pool. And so we're in and out of the pool, but we might be spending some time on the sidelines instructing and providing some feedback to patients. But we also in the pool quite a bit, doing different treatment modalities in the water with people and instructing.
Yeah, I had no idea as I reviewed your website that you guys do hands-on treatment in the pool, right? And there's so much benefit to that. As I was thinking through it, I'm like, there's so many times I want to like offload the weight of someone's head and work on their neck muscles. And you could say, yeah, well, you're laying on a table and the head's supported. There is a difference when the water, that buoyancy is buoying their head up, right? And they can fully relax.
Exactly.
Tell us about the science behind water and why water helps so much with pain.
Oh, there's so much. I'll go in as much depth as you want me to, but it kind of starts. So water immersion is the key. Everybody kind of thinks first about buoyancy, and buoyancy helps to offload joints, and that tends to be a pain reliever by itself. But the real key to medicine in aquatic therapy is hydrostatic pressure and immersion in
So
the
not
water.
just unweighting the body, but the pressure on the body.
Exactly. And that creates a myriad of changes internally that somebody doesn't really recognize.
And many people just think like, I'm going to get in the pool because I'm overweight and I want to feel unweighted. But you're telling us there's so much more than just that.
So much more than that. And that is one of the things, and the concepts behind this. It shows us that water immersion is a chemical and a biological mechanism for internal changes in the body. And those internal changes go down to the cellular level, to chemistries that are being released in the body to either improve an inflammatory process or to create inflammation. It changes the heart, it changes the lungs, it changes the neurological systems, it changes brain function. There are studies out there that are looking at even dementia and Alzheimer's and some of the treatments that might be able to help improve it just by getting in water. So immersion by itself, passively, just get into a body of water up to neck deep. It changes first blood flow and where the majority of your blood is in the body. And that means the compression of the water first kind of at the ankles pushes and compresses and forces it upward towards the chest. Once it's up there, that changes the mechanisms of the heart. So now the heart is getting more blood into the chambers and getting an elastic expansion. It makes the heart more efficient. You won't have to work as hard. Your heartbeat will go down just by getting in the water. And there are certain hormones that are released from this process that will change blood pressure, will change pain, and will change a whole bunch of things that just help somebody, one, just feel relief, and two, to improve some of the other processes going on in the body. It's very impressive. When you get to the nitty-gritty, I could really geek out with this stuff and give you a whole bunch of details, but the bottom line is the getting into a body of water creates many changes on root levels that most people would never know about. They would know first that it's decompressive. And when I get in, I can move. It's much easier to move. People with certain neurological conditions like Parkinson's that have difficulty with movement will increase their movement in the water, and it's easier. If you have arthritis, it offloads the joints. Those are the things we think about first. If you get into the deeper concepts of the water, we really have an opportunity to use it as a medical treatment. We have a lot of pharmaceutical drugs that have the same effect as just getting into water without side effects.
Yeah.
Right?
Yeah. I mean, I love what you just said. Like, we have the same ability in the water as medicine,
Yeah.
right? Like an actual oral medicine that we're taking that has a lot of side effects from it. You can have the same result just by getting in the water and moving.
Isn't that amazing? So you can get in the water. It can be an antihypertensive. So if you have high blood pressure, getting into water repeatedly might help you reduce your need on a blood pressure medication.
Yeah.
Antidepressants. A lot of people are on antidepressants. The results from getting into water can help people wean off of antidepressants.
Tell us what, we didn't talk about the nervous system much. What does it do to the nerves with that hydrostatic pressure?
So as you get into the neck deep water, it elevates and changes that blood flow again, and the diaphragm tends to raise up. And maybe a best way to say is that it tickles the vagus nerve. And the vagus nerve is responsible for a parasympathetic response, which is our rest and digest system. Usually when most of us are coming to physical therapy because we're in pain of some kind, and it tends to put us into a sympathetic bias. That means we're kind of on fight or flight all the time. It's really hard to get out of it. Some of the things we do in physical therapy, land or water, really help. But just getting into water changes that because you have stimulated that restful nervous system.
So when I was, we talked about this at the beginning, but when I first started physical therapy, when I opened my clinic in South Jordan, there was a pool across the street. And I would go over there once a week, and my particularly challenging patients that had a hard time on land, I would get them in the pool. Mm-hmm. And these concepts we'd go over with patients, and they loved it, right? It was so meaningful to them to get in the pool and feel that pressure on their body and be able to be unweighted, there is that portion, and just calms down their nervous system. Right. And we go through a series of movements where we teach them to breathe in the pool, and they just feel so much more relaxed, and being able to calm that vagus nerve down and put them in that parasympathetic state that you were talking about. Because so many of us live in just a very sympathetic life. And that means just highly anxious, super, stressed, 10 out of 10 stress all the time. And what that does, as we know, is dumps cortisol into our body, which cortisol is breaking down our tissue. And we're trying to repair and, build up things, but yet our brain is dumping cortisol into our system and doing the very opposite, right? So it can be such a good tool just to decrease anxiety, decrease stress levels, get moving freely, get feeling better. I love all those things. Tell me what it does for muscles.
So in the pool, you'll get better blood flow to muscles.
Yeah, because is what it did to the heart, right? You were saying the chambers expand. If you're thinking about a balloon, the balloon is expanding to max capacity, and you're getting better ability to use the heart, which then it's pumping more blood, right?
Good. Yeah, so you've got a better pumping, or a more efficient, we'll call it, pumping mechanism from the heart. The drag forces around the body create a friction on the surface, which creates the release of nitric oxide in blood vessels around the surface. The nitric oxide opens up and dilates blood vessels around the muscles. So there is a far better response in blood flow to muscles, creating a more efficient system and muscular use of energy too. And somewhat fascinatingly too, with a lot of us kind of backing up and going to a little bit of a nutritional concept, one way or another, we tend to be loaded with glucose. We consume a lot of sugar.
Yeah.
And we use it, right? We use it for energy, and the muscles need sugar for energy. That's a primary source of their energy. But sometimes we have too much of that, and sugar on its own actually kind of stimulates a painful response, an inflammatory response, and it kind of lights up the cells in the brain that are responsible for some of our pain, to amplify our pain. When we're in the water, the muscle cells have certain gates that open up mechanically. Normally we think insulin is the hormone we use to open a gate into a muscle, let sugar in so we can use it. And some people struggle with insulin issues. When you get in the water, mechanically, you don't need the insulin. You can open up the gates to the muscles and flood them with whatever circulating glucose you have, kind of like an emptying of the bathtub effect. That has a huge effect on the energy available to the muscle to be used and the ability to kind of reduce some of
the hydrostatic pressure that allows those channels to open?
It's the use of the muscle with the elasticity of the blood vessels that allows that to open.
That's awesome.
Yeah, it's amazing. So you're getting all these different effects from just getting in the water. Now, when you start using those muscles in the water, there are other hormones that are released that start blocking some of the inflammatory signals. So you get a little bit of a dampened inflammatory response, which will help with pain.
Yeah.
It's amazing the things that are happening on the inside.
Yeah. Yeah, it's so wild, and it's such a simple thing, right? It's no side effects like medication does, and has a very powerful result.
Right.
So talk to me about how often are you recommending for people to get in the pool to see changes? I mean, we got so many different cases here, right? But say someone that's just like, I have arthritis, I want to exercise. Maybe it's not like so important to see a PT. Maybe I want to try it on my own. If you could give just a general blanket recommendation, what are we starting with, and how long in the pool, what kind of just rough exercises would they be doing?
To start, you would probably spend maybe 2 days a week. One of the things, in our pool specifically in clinic, is very warm. It's 95 degrees.
Love those pools.
So
we need more heated pools.
Yes, we do. Warm water, the warmth has its own relaxation component.
I went to a rec center the other day, and I had my 4 kids, and they're not wusses. Like they're tough kids, and they were all freezing.
Yeah.
And they didn't want to swim. They were just so cold. I'm like, go move, guys. Go down the pool. Go run. Like, go swim. And they were still just shivering. Like my little 18-month-old, he was just like doing this. I'm like, we got to warm up the pool a little bit more.
That's true. Yeah. The warmth has this huge effect. So the hard part is finding a pool, first of all, that is tolerable in temperature. And that's what, when we're seeing patients, the thing they love the most isn't just that we have a pool. It's just they walk in, it's like, oh, that is amazing. Like I think of it as a huge
Soothing.
bathtub.
Yeah.
Yeah. But in order to get some of the effects, you don't really have to be in a pool very long. You could be in a pool for 30 minutes if you're willing to go through the changing and getting into and out of a pool. It takes a little bit of time. One thing we talk about is it's a tedious thing to do pool therapy or pool exercise, but well worth it. If people would be able or willing to get into a pool or even a bathtub, or if they have a hot tub at home, it's not quite the same because the depth of immersion creates a lot of these changes.
Does it matter depth of immersion laying down versus depth of immersion standing up?
Yeah, because the pressure is greater, deeper. So if anybody's ever taken a dive into water and you feel the pressure in your ears, it amplifies the deeper you go.
Is that deeper pressure good?
Yes, but we're thinking standing. So the deeper pressure starts at our feet and ankles.
Yeah.
And then it somewhat lightens up as it comes closer to the surface.
Yeah.
So if we're laying in the water, we're getting benefits from it, but we're not getting the same pressures on the body as we do if we're standing. So if somebody were to be able to get into the pool and even just go for a walk, out of all the things that have been researched in pool therapy and exercise, the one that always comes back, walking. Walking or aquatic running, which is close to a bicycle in the pool, but having somebody at neck depth moving.
Yeah.
It doesn't have to be specific per se, unless we're prescribing something for a particular diagnosis.
Yeah, that's great insight, especially for those that are like, I just want to try it, right? Just get in there and start moving around. You get a lot of benefit from just walking.
Absolutely.
When you were talking about that, I thought about when I was in school. A lot of times we think about pool therapy as those with chronic pain, overweight, arthritis, neurologic conditions, but I really want to just spend a minute on these higher level athletes and turbulence. Tell us what turbulence does in the water and how you use the resistance of water to train people that might be getting the higher level training.
Yeah, you can absolutely take the lower level person like you're talking about who wants the pool just to be able to move and go all the way up to athletes. And a lot of athletes in rehabilitative purposes use pools. A lot of sports teams, colleges, they have some of the higher level pools with the hydro treadmills and things like that. And they're great. They're great. But the great thing about it is there is an exponential increase in muscle energy and work with drag. So if you move 2 times as fast in water, you get 4 times the resistance.
I love things that you put a little effort in and get a max benefit from.
So that's a huge benefit to anybody because now you are in charge of your load. I didn't load you with a specific weight that you have to pick it up, right? You are in charge of how fast you move. I might be able to give you some devices, dumbbells, fins, things like that. And those things will add resistance because it's a bigger surface that's moving against this water. But you're in charge. Mm-hmm. And if you amplify your movement in the water and amplify some of the aerobic exercise, you also start stimulating a hormone that the brain produces to create more neuroplasticity, which we use to help describe changes in the nervous system. It allows the brain to grow and learn, basically, is the way to put it. So there's a specific hormone called brain-derived neurotrophic factor, and that is released specifically when you get in a pool and you work a little bit harder. So you get all these different things that are happening, and an athlete will get the resistance without the compressive load, and they will be able to train and be able to improve in a number of their own mechanical things they need to do in an athletic event. There's a particular research study that showed a difference between training volleyball players. They were training vertical jump. They trained one group on land. They trained one group in water. They trained the same thing. They were just training vertical. And then they measured the difference between the 2 groups after a period of training. And surprisingly, even to me, the water group improved their vertical more than land. And it has to do with just how much you have to move the heaviness of the water out of your way to produce the power to jump.
Yeah. And if you haven't tried that, just go do a squat in water and try to power up and jump. It's difficult. So talk to us about the tools that you use in the pool and what each tool does. Because we're thinking, those that are listening to this are like, okay, dumbbells. How are dumbbells different in the water than on land? Because on land, you have the whole stack, right? It's like 1, 2, 3, all the way up to 25, whatever. Right. Or they jump by 5s. But in the pool, it's a little different. Tell us about these tools that you use.
So you have a number of different tools. A lot of them are just different brands, but same ideas. You have dumbbells that are usually plastic and they're made for drag. They'll be bigger or smaller. So you hold them in your hands and the way you move in the water based on speed.
Just 2 sizes, small or large?
Depends on the brand. There's a whole bunch of brands. There are different formulations
of them. Can people typically get these at a pool if they go to like a city pool?
Most of the time. You will always find buoyant dumbbells. You'll always find noodles.
And those are like your floaty dumbbells.
Yeah. Those floaty dumbbells and noodles are everywhere. And a lot of the rec centers have belts. The jogger belts, we call them. And you can put that around your waist to give you some elevation in the pool, and you can do aquatic jogging or running.
Yeah, let's go through each tool and talk about, maybe give some examples of why you use a belt, why you use the buoyancy dumbbells, why you use the drag dumbbells.
So the buoyancy dumbbells provide resistance downward. So it's almost like reversing weight. I want to create a resistance in a certain direction. I'm going to work different muscles of the body. I use the dumbbells for those purposes. Most of the time I use them to pull into the water for one reason or another. And there's different buoyant devices for ankles and feet, and there's dumbbells for the arms, obviously. You have those devices could also just provide float. And maybe I've taken somebody and I want to increase the instability of what we're doing. So instead of having them with their feet contacting the ground, we go float. And we give them dumbbells just to help provide float, or a belt to provide float. Instead of having points of contact on the ground, on a wall, on a bar, you're free floating and the water is constantly moving. Now the exercise is usually something to do with control. Can you control a particular motion with these devices in hand and flotation? The drag devices are meant to load muscles, particularly depending on the type of device. It might be fins on the legs that can be used like a dumbbell in hands. That can provide resistance to the muscles in any direction, and that's a big benefit because when I go to the gym and I'm working against weights or elastics, I'm always working against some form of return. So gravity goes down, elastics or cables go back to their point of origin. It's mostly unidirectional. In the water, it's 360 degrees.
Yeah.
Every movement you make
and
is
just to
resisted.
like really clarify what you're saying, unidirectional is the motion that you go into has to be linear. It has to go in a straight line, right? So elastic, you're pulling away from where it's anchored. A cable, you're pulling away from where it's anchored, but it's only going one way.
Right.
But in the water, you can go all directions, get 360 degrees resistance.
Exactly. Yeah. So, you could move a weight in 360 degrees, but the force is always downward, right? So that's something that's really great about the water too. So now I can take, say, a drag resistance dumbbell and have somebody move in very functional ways, reaching for things, moving your legs in different ways depending on the type of activity you do, against more or less resistance based on how fast you go, which is great. There's a number of unique tools too. There's water cycles out there. We have one.
So like a bike underwater.
Yeah, a bike, and it just has fins for resistance. So you pedal it in the water.
They wear a snorkel and go underwater.
They could.
Right?
They could. We have
add some extra lung resistance.
Yeah, yeah. We have an aqua pole, which is unique too.
Is there like a lift in your pool where you can put the bike on and choose the depth at which you
I
put
would
them?
love that, but no. It's a pretty old standard pool. Okay. We have this aqua pole is something I'm always looking for something new and interesting, right? I try to keep therapy interesting, and a pool helps.
Yeah.
Sometimes you just need something unique.
Yeah.
So an aqua pole, one of my patients introduced to me. And she said, we should do pole dancing in the pool. And I said, what do you mean pole dancing?
Why not?
And she happened to find that there was some group in Massachusetts that had these poles with a base that suctions to the pool floor.
Ah.
And over time we decided,
tried pole dancing,
let's
man.
try
it. Is hard to hold your body weight on a pole.
Exactly. So now we have this pole, we can do all these, we'll call them pole dancing movements, but they're really just a lot of controlled mobility and core work in an environment where you can do it. I couldn't do it on, no way.
Yeah, absolutely.
I can't do it on land.
I'm surprised it can create enough suction on the pool to where you can put your body on it and pull in different directions.
I was too. And actually, in the beginning, it didn't stay.
Oh, okay.
We had to refinish the pool.
Oh, it had to have a nice, smoother surface.
And then we put in some tile so that we could really get it to suction down without it tipping over. But then that comes with a kickboxing bag. So we could do kickboxing in the pool. And that is amazing for somebody like Parkinson's who needs a targeted movement pattern and not really safe to do it on land.
Yeah.
I can do it in the
I used
pool.
to run a boxing program for people with Parkinson's disease.
Yeah.
It's very meaningful to them. And we called it, when I was at the University of Utah, I started the program there. We called it You Fight PD. So the University of Utah, and you're essentially fighting back against Parkinson's disease. And they
That's
loved
amazing.
it. They loved hitting the bags. They loved hitting the mitts, working with the students. It was a blast.
Yeah.
But yeah, like I love the creativity and giving people options. So how do you, we're going to dive into the different diagnoses that's going to be helpful. The pool can be great for anyone, but there's certain things that you treat in the pool, certain conditions. But I really want to know, how do you match up the impairments? Like we talk about impairments in PT, like the things that they struggle with. Say it's just hip range of motion or hip strength. How do you match that and get them to kick a bag? Like what's the correlation between that?
Between like deciding how to apply it in the pool, you mean?
Yeah.
So it depends on how you're gonna use the different properties of water, right? Buoyancy and drag and stuff. If somebody has hip range of any range of motion, including shoulder, neck, you would think that that's maybe too much above the surface and it won't be applicable. Range of motion, always great in the warm water, always great. And you
Tell
can
us why.
Because the freedom, it's freeing. So we've talked about some pain relief, right? There's decompression in the pool, so the joints aren't loaded like they usually are.
Yeah, because you're out of the pool and everyone's all tense.
And you're
you get in
tense.
the pool and people are like, oh,
That's
and relaxed, right?
So, and we talked a little bit about like cortisol and stress hormones, and the pool addresses all of those things so that when you move, there's less fear and anxiety. There's more freedom to move. So the range of motion will improve just because you're in there. Now we can start training to achieve your optimal range of motion in whatever joint that may be. And then strength comes, it's hard to measure how to strengthen, particularly in the pool. We don't measure forces, output, and stuff like that in the pool. But when you can add weight load, just like out on a land surface, but you can add these buoyant forces and drag forces and do more repeated motions on a muscle without the same soreness that you get on land. And that's a huge advantage because, as we talked about, the circulation changes. It helps to flush out some of the lactic acid and things that come from exercising.
Yeah.
Some of the exhaust, so to speak, from using the machinery of the muscles.
And ultimately, when you have that delayed onset muscle soreness, we call it DOMS, there's little microfiber tears that are happening in the muscle, and the hydrostatic pressure feels really good on them. If you've ever had, vasopneumonic compression, which is like the boots that go in people's leg after a workout, the compression feels good.
Right,
And,
it does.
And that could be a good resource for recovery, not to speed it up, but just to feel good in the midst of being really sore, right?
Absolutely, yeah.
And also increase blood flow.
Yeah.
And I guess that would be the mechanism for increasing the efficiency of recovery is that you're getting increased blood flow, and you're also getting blood flow out. Right, and it's just improving the circulation in the limbs.
So you're improving circulation to muscles to provide them more energy sources to be used.
Yeah.
But then on the flip side of that, the byproduct from using your muscles, there must be some sort of byproduct, and we think of lactic acid the most. That creates the soreness. But by opening those blood vessels and working in water, you also flush it out. And in addition to that, you get hormones released there like diuretics, and diuretics fill the bladder. So any of we'll call it the inflammatory soup or sewage from all the byproducts from movement and living get flushed out better, because we're getting it through the circulatory system, but we get it into the bladder and we'll excrete it. And anybody that's been in a pool probably knows you just tend to have to pee far more frequently. And you think how much of an inconvenience that is sometimes, right?
Absolutely, yeah.
But if you knew how that's working to flush out all the toxins and we'll call sewage from the work that goes on in the body, then you would understand, that actually ends up being a huge benefit to me.
Yeah, I love that. So tell us, what are the top 3 conditions you see in your clinic for getting to the pool that's most helpful for?
Back pain. A lot of back pain, folks. And a lot of that comes from a patient's self-referral or a physician's referral or something that acknowledge the unweighting of the spine being great for somebody who's in pain.
Yeah.
That's really the number one thing. Number two, chronic pain conditions of every kind. That often may be something like a fibromyalgia. And fibromyalgia has been proven. In fact, at one point, there was the only FDA-approved treatment for fibromyalgia.
Yeah.
Now there's some better
medications didn't work back then. Yeah. Like there was just not a lot of resources. Right. It was just like, good luck.
Yeah. And people would be in pain, and then they get deconditioned and they can't do as much.
And then increases their pain. Yeah.
Exactly. So now you can utilize a resource, a pool, get in the pool and reduce your pain and recondition your body so that you can do more.
Yeah.
And slowly that will change what you can do outside too. Oh. So chronic pains of every kind. And then the ones that everybody would think of first, people who can't walk or have difficulty walking. And that might be arthritic, post-operative replacements of the knees or hips after a certain period. It might be neurological conditions like Parkinson's, MS, even some spinal cord injuries or partial spinal cord injuries or nerve-related
even think
issues.
About like changing mental programs, we could call it. We call it neuroplasticity or motor pathways, whatever you want to call it, but essentially you're retraining the brain how to move.
Right.
Especially someone that's had a stroke where the brain might not remember how to move, or there's certain disruption in the brain or damage. You're retraining those muscle memories in a hydrostatic, unweighted positions, right?
Exactly.
And can retrain walking patterns or arm movement patterns. And with resistance as well. Yeah. There's so many benefits to that.
Right. And you can do, a Parkinson's person or a stroke patient or somebody, like I said, that's more frequently in the clinic, a low back pain patient. Oftentimes they have a hard time tolerating or being able to do something in an upright position. I can't do it. I have to do it on a table because I'm in pain, or I have to do it on a table or seated because I just can't functionally stand. Mm-hmm. Now we can put them in an environment where we can do things vertically.
Yeah.
And we can start training some of their functional movements.
I just think about all the, when someone comes into the clinic, on a land clinic, and just severe back pain. And it'll take us a week, 2-3 weeks to get them out of that painful state. I'm thinking like, oh my gosh, how cool would it be to get them in the pool in those initial phases, get them moving, loosening up, standing upright. Like that is just got to be so rewarding.
Very much so. And they get in. Sometimes even we in a pool, we can't do a lot. Mm-hmm. We might have to have somebody float. There's a technique we use that's manual. That's called Watsu. And maybe some people have heard of it. Most people haven't heard of Watsu, but the therapist in this case,
haven't heard of that.
You cradle the patient in your arms, and they have some flotation devices to help lift them, but they're on the surface, and we take them passively through movement patterns in a very flowing, almost like a dance.
And they're just
their job,
laying there.
Just lay there.
That
relax.
Actually sounds really nice.
100% relax. Let me do the work. And you go through a whole number of patterns where I mobilize.
So they're just breathing and you're just moving them through the patterns.
Yeah.
And staying relaxed.
And some people do.
Like,
I've had a couple of people. In fact, I had one time I had a lady that was snoring. and she told me she had not gotten a lot of sleep.
Yeah.
And I was thinking, I'm through
I'm gonna
about
put you
an hour
asleep for
now.
an hour.
At what point is it fair to wake you up?
Yeah, you didn't have the heart to do it, did you?
Couldn't do it for a while, no.
You need a good 8 hours of sleep. Let's just hang out here.
Yeah, but there's that is a technique that is pretty unique that most people don't know about, that is really like the client is just as relaxed as you can possibly get.
That's so awesome.
Cradled and moved. And mobilized. So, and while they're doing that, you can mobilize specific joints if you wanted to.
Yeah.
I can mobilize the back. Us PTs know how to mobilize backs in lying positions most of the time.
Yeah.
But in a pool, I have a little more freedom to move around the patient. to do some of these like joint mobilizations. And on the back, I can
describe a joint mobilization to those that might not know.
So a joint mobilization, there's different degrees of it, but you're putting pressure on a joint, trying to move it through the joint specific range of motion itself. On the back, it's a gliding motion. Most joints, it's a gliding motion. For those
who have not had this done, it feels really good.
It feels really good, right? And it depends on your tolerance. You can push a little bit more. I tell patients it's like, especially on a back, it's like CPR to your back. Mm-hmm. I'm doing CPR to your back.
So you're doing it. They're laying on their back, and you're doing it from behind.
Yeah, that's right. We're lifting upward and using their body weight. It feels
so good to be unweighted, muscles more relaxed, and then mobilize it.
Yeah, it's a really cool way to do it. And just, it's a little more, I don't have leverage. Too. It's hard to have leverage.
Yeah.
But I have access.
The body is moving. You're kind of using the weight of the body in water to do the mobilization.
Yeah. But I have access. That's a big deal. So a little more than on a table. I'm limited on the table access, but I have more leverage.
Yeah.
Yeah.
So give us a few tips for each Well, let's just do 2 categories. We'll do just your standard back pain, and then we'll do maybe arthritis, maybe just in the knees. What are kind of some tips and tricks people can try on their own? You know, if they're having back pain, they want to get in the pool and see if this is going to be helpful for them.
Yeah. Okay. So for both these conditions, an arthritic condition, the first thing would be to just get in a body of water. The warmer, the better for most people. So if you know of a place that's warmer, great. If not,
what are most city pool temperatures?
84 to 88 usually.
Oh, they're warmer than I thought.
Yeah.
It feels like 60.
Yeah, it feels cold. It feels cold. And the air temperature changes things, you know. Yeah. The air temperature, if it's warmer, makes the water feel a little bit cooler. And if the air temperature is cooler, the water feels a little bit warmer. So there's some factors in there that change things. But if you can just get into a body of water and just close your eyes for a minute and breathe. You talked about taking patients through breathing exercises. There's Tai Chi. A lot of people probably know Tai Chi. In the water, it's called I Chi. And I Chi is really all about movements under the surface of the water with an association to breathing patterns.
Yeah.
Deep breathing, relaxation. So without knowing how to do these particular movements, get into a body of water and just take some deep, good breaths. Some people call box breathing a good method. So it's like a 4-second breath in, hold your breath 4 seconds, 4 seconds out. Hold your breath
funny.
4
I got
seconds.
a funny story. I was in one of those cold plunge places, and I was all by myself, and it was beautiful. And there was the sauna, there was cold plunge, kind of going back and forth. And this gentleman comes in, and he took it upon himself to instruct me on box breathing. He didn't really give me a choice. He was, let me walk you through box breathing.
That's great.
And he would follow me back and forth between the sauna and cold plunge because he wanted to do it with me. Yeah. And I was just like, I'm not interested, man. But he kept following me. So that was the first time I heard the term box breathing is in that sense. So I'm an expert now.
Yeah, you must be now. Yeah. So, yeah, I mean, honestly, the easiest thing to do in terms of like getting the first initial benefit from the water is just get in.
Yeah.
Just get in. And
give us some tips on how to get in. For those that might be fearful, they're like, do I just jump in? Do I like in the deep end? Like,
we do tease a lot in our clinic, and it does say no diving, but we do offer the opportunity to be pushed in the pool for those that would rather that.
How many patients have you pushed in?
None, thankfully. None. I did have one time that wanted to show me the Chinese stinking dive. And he was desperate to show me this. And I was like, no, I don't want you to show me the Chinese stinking dive. Please don't. But he found himself on the outside and he did it anyway to everybody's fear. We were okay, but that's the only person that has ever dove in the pool. Otherwise, so our pool is older, it has stairs and it has a ramp. And then we use a wheelchair made out of PVC to go down the ramp for somebody that can't access the pool.
So there's multiple options.
Yeah. And then
you can walk down a ramp with a handrail.
Yeah.
You can walk downstairs with a handrail. You can get a wheelchair.
And then
What
there's
else we got?
usually there's lifts. And every modern pool, there's a lift. And if it was built after the American Disabilities Act, that is part of what you have to build
and
now.
anyone can use a chairlift, right?
Absolutely,
if you go to a city pool and you're just like, I want to get
I
in the
don't know
pool.
how to do this, and it's really easy to. I mean, usually they're covered, sometimes they're not, but there's a little button usually that just you power it on, and most of the time there's a remote control. And you sit in the chair, and the remote control will swivel you around and then drop you in the pool, and it will stay there until you're ready to get out, and then same remote control set on the side. You get
Pull you
yourself
right back
out.
out. Yeah, it's actually really sleek.
Very
when
sleek.
I first saw it, I was a student in an internship, and I was like, I was so scared. I'm like, how do I use this lift? And it's literally this button.
Right.
It's so simple.
If somebody's a little fearful, like they don't have a lot of control, there's usually a belt.
And you actually have a seatbelt too.
That's right. There's a belt to keep you in the seat. And I've used that with people with neurological conditions.
Yeah.
So
I had this 95-year-old gal that she was a patient in the clinic, and her number one goal was to be able to get in a pool. Like, we could do that. Let's just go do it together. She's like, well, how? And I explained all these options. I remember I wheeled her down a ramp on a wheelchair with like the beefier tires, and we got her in the pool. That gal was swimming for almost an hour straight. She just felt so free. It was so empowering to see. I remember to the day.
So cool to see.
What happened.
I have a particular Parkinson's patient that's been around for a while, and he was athletic growing up, and he if you watch him walk, he's got freezing gait, that we call, and he has a hard time initiating his movement, and then he stumbles through walking, and he's not safe. We don't want him walking on land, but we get him in the pool, and now we start playing games. We've been playing football tossing. And he runs and he dives and he
looks
jumps,
like a totally different person.
And he had an assistant there the other day with him that said, "This is amazing," because they hadn't seen him in the pool, and it was the first time they watched. Like, what is he doing? And he was playing keep away from a couple of us therapists.
What a cool thing!
And that's just so empowering to see a completely different person from land to sea, as we would call it.
Absolutely.
And just amazing. And for him, he's having fun. And that's another component of the pool that people may or may not know. There's a fun,
It's a good time.
Yeah, it's fun. We have fun. We play games. We do different things in the pool.
It's very different than your standard land PT clinic, right?
It's really
so we
different.
try to have fun.
We do.
But,
it's
there's
hard
a
to have
different
fun
level of
on
fun in
land.
the water.
Yeah. And now we get silly sometimes. We have people walking on a ball like a circus animal, and they might ask me why. Well, there's always a purpose. I want to work on some foot and ankle mechanics and some balance, but this is a fun little game we play, you know. So there's a lot of things, a ball toss. We've put in other games and things into the pool, but we do try, because I know, and for us, the therapist too, so patients might not know, but we want to make it entertaining and fun for us to be the therapist.
For sure.
And we're always looking for something, some way to enjoy this moment with you, not just put you through the paces, so to speak. The water's it's a nice, like you said earlier, you said creativity. And that's something I tell student interns when they come in. Like, you are safe here to be creative. Think through some of your own ideas, because a lot of things go here. We're not going to hurt people here. It's very hard to create a problem.
I remember putting together like a list of exercises, and then eventually I got to the point where I'm like, why don't I just have this list of exercises? Let's just play a game.
Yeah.
You know what I mean? And we integrated all those exercises into the game.
Right.
Rather than it's like, let's just do standing marches and standing hip abduction in the pool, right?
Yeah.
They just have their place, but man, you get someone excited for like a competition or a game, and it's a different level, and they work harder.
That's right.
And it can be challenging. You can make it super challenging.
You can make it real challenging. You can make it real easy.
So what are your tips as we wrap this conversation up? What are your tips taking people from the pool to now land and progressing them?
So part of it is homework. The homework is probably most of the time land. little things
Yeah.
that they're doing on a day-to-day basis against their usual environment.
Yeah.
But slow integration. And that means like sometimes if you have the right tools or pool, you might integrate more weight into the exercise. For us, we have 4 to 5 feet depth. It's not a lot of variation, but ramps and stairs give me some variation. So now I can start loading somebody slowly and then bring them out of the water and load them completely to do whatever task that we want to do. So slow integration would be a real key, and not just going from, hey, I feel good in the pool to I want to go to the gym now and do what I consider a traditional workout. Like I'm ready for that, right? Probably not. Maybe. But we would want to very slowly integrate some of those exercises or activities.
Yeah, when we say slow, it's hard for the public to interpret what that means, right? Because they're like, well, I just walked in the pool. Why can't I go walk out here, right? But that's why it's so important to have a skilled therapist to help you build that bridge, because it can be challenging. Slow is a very broad definition.
Very broad definition, very individual. So it's hard to say for you, slow means, we're going to do this in over the course of a month. Mm-hmm. And for another person, we could probably get you there in a couple of weeks. You don't need a lot of this.
Yeah.
So it's very hard to just broadly state, there's a time frame for everybody.
Absolutely.
It's very individual. And that is truly part of the skills of the PT is we call it dosing. We're going to dose you. We prescribe the treatment and the exercise as a doctor of physical therapy, and we're dosing you back to your normal function or the activity or whatever it is you want to do.
Yeah, I love it. As we wrap this up, let's see if we can summarize our top reasons for being in the pool. Can you list them off for us? So let's just say top reasons for getting in the pool.
Top reasons for getting in the pool. Number 1, the effect. So you get into the pool and immediately you're met by those properties of water: buoyancy, resistance from drag, the compression from the hydrostatic pressure, and all the things we talked about that happen internally. Number 1 thing is just getting in, the medicine that's taking place from your own body's ability to make some changes. Number 1 reason. Doesn't matter what impairment it is, doesn't matter what your diagnosis is. If you're appropriate to get into a pool, it's amazing for pretty much everything. Number 2 reason to get into the pool would be any sort of pain, specifically pain.
And specifically for blood flow.
And blood flow, yeah.
Decreasing nerve irritation,
right.
Calming the body
you
down.
You have a lot of properties that and on a different levels: the nervous system, the circulatory system, a lot of things in the endocrine system, hormones that are all changing by getting in the water passively, and then adding. So that would be kind of the I swallowed the pill, I got in the water. But now, in order for me to make the most of that, I need to do something actively. I need to spark the use of that pill, so to speak. Movement. Any movement. We talked about walking is great.
Yeah.
Yeah.
Well, thank you for sharing your expertise. Any other thoughts or tips or things that come to mind when someone's thinking about using a pool for therapy?
I think the most common thing is that people don't know, one, how many resources are out there. And there's a lot of PTs that we have, maybe an assistant or somebody that at least has access to a rec center that we can go to and do some aquatic therapy. There are very few clinics with a pool on-site, warm, and not just a treadmill pool, right? Yeah. That's hard to find. But know that you don't have to utilize the particular PT clinic with the water in it to get the benefit. PTs we can prescribe you some simple things just to get in the pool and utilize a pool at wherever your resource is.
Yeah. I love that, because then it empowers our therapists. Like, yeah, we can. So if you're a patient listening to this and you're like, I want to try the pool out, talk to your therapist, even if they don't have access to one, and talk about prescribing ones that you can do at your pool at home or your pool at the rec center. I love that.
Yeah. And you might have a hot tub at home, and you may not have the depth to do all this immersion and get the benefits from that, but you're going to get a lot of benefits from that hot
Love
tub.
that.
And that's a simple way too.
If people need to find you, for you as a resource, how would they find you?
Well, you can find us. Like you said, we're Sandy Physical Therapy and Aquatics. That's the old name. We changed it to emphasize what we're doing the most, and that's Sandy Aquatics. It really is, the clinic is about aquatics.
So Sandy, Utah.
Sandy,
you have your
Utah,
clinic there.
90th South, and you can find us online at sandyaquaticspt.com.
Great. And the beautiful thing about Brian is if you don't live locally, if you reach out to his clinic, he can give you resources across
Absolutely.
the nation. Really, he has connections
that's right.
all over, because the American Physical Therapy Association essentially is a group, a network of people that have resources across the nation. So reach out if you have questions. But
Absolutely,
thank you,
yes.
Brian, for your expertise in this area. So cool to discuss a unique topic.
Thanks for having me.